Today I want to speak to parents about what shouldn't be a controversial subject, but unfortunately it is. It's kind of has historic roots, and that's about extraction, because we don't want parents or anybody worried about the necessity of extractions in orthodontic treatment. And yet there is a fringe of orthodontists that I would totally disagree with, that believe, and the scare tactics, saying that any orthodontist that takes teeth out for any reason whatsoever, it is amputating a part of the body unnecessarily. Well, that's just a falsehood. The irony of this is these same orthodontists that claim that, and we'll get into why they think that in just a second, why they think that taking teeth out is destructive in some way or another. And yet these same dentists will recommend the removal of the wisdom teeth of their patients. That doesn't make any sense. If it's wrong to take out teeth for orthodontic reasons, then it's wrong to take out wisdom teeth that are impacted if they do that all the time. So it's silly. It doesn't make any, it's circular reasoning. Now let's get to what's really important. Orthodontists, we cannot grow jaw sizes. You're genetically programmed to, by your biology, your physiology, your bone is a certain size, and the teeth have to fit that bone appropriately and be in good support from bone on the outside, bone on the inside. So you can't indiscriminately just move teeth where you think you'd like to have them. So the jaw can only hold in health condition only so many teeth. And our jaws over a period of, I guess, hundreds of years or so are smaller. We don't have the same size jaws of some racial groups, in other countries. America is just such a hodgepodge of all kind of races, creeds, and everything else, nationalities, and we're just a Duke's mixture. There's no homogeneous strain of a human racial anymore. So this mix-up just means that we've got a few more problems, and we don't have room for all of our teeth. So I want to be clear about that. I have never, ever in my whole career regretted the removal of teeth when it's necessary. I have regretted sometimes that we didn't, and we had to come back later and do it. So it's all a question of where the teeth are supposed to be, how they balance with the lips and face, and that all has to be in harmony. And I'm here to tell you, parents, you don't need to, if your child needs some teeth out for orthodontic correction, believe the orthodontist. The fringe element has put a scare tactic, and here's the basic reason, and it's also false. They have laid the claim out there that if you reduce the size of the mouth in any way, shape, or form, you're going to create sleep problems. You're going to create breathing problems, and it's going to contribute later on to sleep apnea. That's kind of the underlying current in there. And that is as false an assumption as there could possibly be. The mouth is not the airway. The airway is the nose and the collapsible tube, the pharynx, and the windpipe behind it. It is not the mouth. The size of the mouth is not contingent on how well you breathe or don't breathe. So that's fallacious argument. There's so many reasons why people have difficulty breathing properly, but the size of their mouth is not one of them. So rest assured that. So it's time to just stop some of the nonsense that goes on in our profession, and I hate it. And I hate to see anybody misled and find somebody that they agree with. A lot of parents are resistant, of course. I mean, the percentage of extractions nowadays is remarkably low. It's not high. it used to be much higher because just the fact that you had bands on the teeth instead of now with bonding, we don't have all the bands that we used to, but putting on bands on all the teeth, my goodness, that took up a lot of space. And some of the reason was because we had to band the teeth, that we needed to take teeth out because the amount of room the bands and all the cement took up. So anyway, that's a bygone age. We don't do banding anymore. We do bonding, and that has helped considerably. And we do, and this is another item that is important, that we do what we call interproximal reduction in between the teeth. Sometimes it's wonderful. It's the best thing in the world to do a little sanding between the teeth so that the teeth are really reduced a little bit in width. So that, again, you have room to keep the teeth in a healthy condition and lined up. So I just wanted to make a short video and assure you that extractions are not harmful in any way, shape, or form. I'm a good example of that. Nobody on earth would think that I need more teeth in my mouth. And I'm 4 short because of orthodontics. And I'm grateful that they're gone, and I've got a much better situation than I would with 4 more teeth in my mouth. Couldn't hold them. So anyway, I hope that helps your parents to get a little bit more peace of mind about extractions, and glad to have the opportunity to talk about it. Thank you.